Hi, my name is Jennifer Hawkins, and my speech today is over patient safety in regard to patient ratios. When your loved one is in the hospital, you don't consider the importance of the nurse to patient ratios, how this can impact the number of falls on your unit, or in addition to nurses just being overwhelmed. The nurse to patient ratio is when you have a certain number of patients per nurse. Ideally, 4 patients for every nurse is ideally a good ratio. They have enough time that they can devote to each patient. They're not overwhelmed. They can answer questions, concerns, anything that might pop up that the patient needs to be addressed during their 12-hour shift. Fall risks are another one that is you don't want your patients falling. There can be several reasons that they do have falls. They are not completely off of the anesthesia. They think they can get up. It's not a good idea to get up alone. They're just unsteady. They were unsteady before they had their surgery. The surgery just made them a little weaker. Their altered mental status. They don't have all of their normal mind together. They think they're fine. They can just get up and go to the bathroom alone. They don't need help, so they don't call for help. I read an article where hospitals should have a dedicated team working to reduce patient falls. We have at our hospital, they call them telesitters. It's just a camera in the room where someone is constantly watching it, telling you, no, don't get up. No, don't pull on that tube. Just to kind of help offset of another person that has to be in the room with you at all times. Nurses are overworked. They can be overworked due to being short-staffed. So they miss their meal breaks. They miss their lunches. They don't have enough time to sit down and think, let alone get to every patient and get everything that they could possibly need. There's been a lot of studies done where assigned nurses impact their ability to provide effective patient care. In hospitals that have a lower nurse to patient ratios, patients are more happy. They feel like you're not rushed every time that you go in a room. So they can give you more of the time and attention that you need. When your loved one is the one that's in the hospital, you don't think about that type of stuff. You don't consider the importance of nurse to patient ratio. That's not your thought. You're focused on your patient, your family member. You don't really just think about how all of these different things come into play with your loved one being taken care of properly. I work on a med-surg hospital. We deal with a high number of turnovers because we do orthopedic. So you have surgery one day, 2 days later you're out. You want to make sure that you're giving them the proper care, the proper time and attention that they need, whether if it's just their pain meds or they have questions about their surgery because they just had a major joint replaced. These are all things that you have to configure in when you're doing patient to nurse ratios. Thank you for your time.